Hello everyone, here I am with my very first topic, which is arrhythmia. Now, what is arrhythmia? Arrhythmia is also known as dysarrhythmia. Abnormal rhythm or rate of heartbeat is called arrhythmia. Defect in conduction system of heart. Normal conducting pathways SA node, both atria and then towards AV node, bundle of hairs, then bundle of branches, then Purkinje fibers. It has two types, which is tachycardia and bradycardia. Tachycardia is fast heart rate and bradycardia is slow heart rate. Types of tachycardia. Atrial premature contraction. APCs are extra heartbeat that starts in your upper chamber of heart. It occurs earlier than expected and briefly interrupts the normal heart rhythm. It originates in the atrial myocardium. It is common in healthy individual. It is not a serious condition. Causes: skipped heartbeat, pregnancy, high blood pressure, stress, smoking. Symptoms: fluttering, missed heartbeat and heart palpitations. Second one is atrial flutter. It consists of rapid regular atrial contraction accompanied by AV block in which some of the nerve impulses from SA node are not conducted through AV node. Causes: it occurs when a short circuit in heart causes the upper chamber atria to pump very rapidly. Symptoms: palpitation, anxiety, shortness of breath, trouble exercising, tiredness. Complications: stroke, disability or death, heart attack or heart failure. Now we have ECG. During normal heart rhythm, we have PQRS intervals like this, but during atrial flutter, the PQ interval is prolonged, usually because conduction through AV node is slower than normal. Third, atrial fibrillation. Signals move around atria in a completely disorganized way that tends to override the sinus node. Instead of one peak contraction, we get many contractions that make the atria look like quivering. Causes: cardiovascular disease, high blood pressure, coronary artery disease, valvular disease, non-cardiovascular disease, obesity, excess alcohol consumption, diabetes, genetic factor. Complications include stroke. Symptoms include general fatigue, dizziness, shortness of breath, weakness and palpitations. Now we have ECG. During atrial fibrillation, no clearly defined P waves and irregular QRS complexes are found. Fourth, supraventricular tachycardia. It is a rapid but regular heart rate that originates in atria, or an abnormal fast or erratic heartbeat that affect upper chambers. Causes: caffeine or alcohol consumption, smoke, stress, asthma drugs. Symptoms: chest pain, dizziness, fatigue or shortness of breath. Ventricular premature contraction. It arises when electrical impulse arises anywhere other than SA node. Causes: occasional abnormal action potential. Contractions occur early in diastole before SA node is normally scheduled to discharge its action potential. Extra beat disturb the normal heart rhythm. These are not life-threatening. Causes: emotional stress, excessive intake of alcohol, nicotine or caffeine, lack of sleep. Symptoms: fluttering or flip-flop feeling in chest, jumping heart rate and skipped beats. Ventricular tachycardia. It occurs when the lower chamber of heart beat too fast, at least 120 beats per minute. Body doesn't receive enough oxygenated blood, which may be dangerous. It can lead to sudden cardiac death. Causes: it is caused by heart disease such as previous heart attack, myocarditis. Symptoms: chest pain, dizziness, fainting, shortening of breath and cardiac arrest. During ventricular tachycardia, no P waves and PR interval. QRS interval is wide. Ventricular fibrillation, most deadly arrhythmia. Ventricles are completely asynchronous so that the ventricular quiver rather than contract in a coordinate way. Ventricular pumping stop, blood ejection ceases, circulatory failure, death occur unless there is immediate medical intervention. Causes: coronary artery disease, electrical shock, chest pain, droning, low potassium level. Symptoms include chest pain, dizziness, nausea, shortness of breath. ECG. During ventricular fibrillation, the ECG has no clearly defined P waves, T waves, and QRS complex.